Miscarriage is a deeply personal and often misunderstood experience. It can bring a whirlwind of emotions and unanswered questions, leaving one feeling lost and alone. This emotional toll can be heavy, and it's okay to feel overwhelmed. Amidst all the confusion and heartache, you may find yourself grappling with a myriad of myths and misconceptions, adding to the weight of your burden. That's why we're here today. We aim to shine a light on the often hushed topic of miscarriage, providing you with reliable, scientifically backed information. We want to help you navigate the sea of uncertainty, to equip you with knowledge and understanding. We'll delve into the medical aspects, explore potential risk factors, and debunk common misconceptions surrounding miscarriage, because sometimes understanding can be a powerful tool for healing. Remember, you're not alone on this journey, and it's okay to reach out for help. Understanding the medical aspects of miscarriage can help demystify this difficult experience. At its core, a miscarriage is the loss of a pregnancy before the 20th week. This is the medical definition, but it's important to understand that a miscarriage is so much more than just a medical event. It's an emotional journey that can be incredibly challenging to navigate. In terms of medical specifics, miscarriage is the spontaneous loss of a pregnancy before the fetus is able to survive outside the womb. This typically happens before the 20th week of gestation. After that point, the loss of a pregnancy is generally considered a stillbirth, not a miscarriage. There's one more distinction to be aware of. Not all pregnancy losses are miscarriages. Ectopic pregnancies, where the fertilized egg implants outside of the uterus, and molar pregnancies where abnormal tissue grows in the uterus, are not classified as miscarriages. These are different types of pregnancy losses with their own unique causes and treatments. You might hear terms like early miscarriage and late miscarriage. Early miscarriages occur within the first 12 weeks of pregnancy and are far more common. Late miscarriages, on the other hand, occur between the 12th and 20th weeks. They are less frequent but can be particularly difficult due to the increased physical and emotional toll. It's also worth noting that miscarriages are more common than most people realize. They occur in about 1 in 4 pregnancies, often before a woman even knows she's pregnant. This may sound alarming, but it's a natural part of the reproductive process. Many miscarriages are due to chromosomal abnormalities that prevent the fetus from developing normally. Despite its prevalence, every miscarriage is a unique experience. It varies greatly from person to person, not just in terms of physical symptoms, but also in terms of emotional impact. Some individuals may recover quickly, while others may need more time to heal. It's a deeply personal journey that should be respected and supported. In the end, it's crucial to remember that having a miscarriage does not mean you're unable to have a healthy pregnancy in the future. Many people who experience miscarriages go on to have successful pregnancies later on. Though it is a common occurrence, every miscarriage is unique to the individual experiencing it. There are numerous causes of miscarriage, many of which are out of our control. One of the most common causes of miscarriage is chromosomal abnormalities. These abnormalities account for about half of all miscarriages. They occur when an egg or sperm has too many or too few chromosomes, the tiny structures within cells that carry our genes. These chromosomal errors happen at the time of conception and are usually random events, meaning they're unlikely to happen again in future pregnancies. Maternal health conditions can also contribute to miscarriage. Conditions such as uncontrolled diabetes, infections, hormonal issues, and problems with the uterus or cervix can increase the risk of miscarriage. It's important to keep in mind that many women with these conditions have successful pregnancies, and having these conditions does not mean a miscarriage is certain. Lifestyle factors such as smoking, heavy alcohol use, and illicit drug use can increase the risk of miscarriage. But it's essential to understand that these factors do not cause most miscarriages. Most miscarriages happen for reasons that are entirely out of our control. Age is another factor that can impact the risk of miscarriage. As we age, the risk of miscarriage increases. Women in their late 30s and 40s have a higher risk of miscarriage than women in their 20s. This is largely due to an increase in chromosomal abnormalities in the eggs as women age. But here's a crucial point to remember. Most miscarriages are not caused by anything the parent did or didn't do. It's natural to want to find a reason or someone to blame when a miscarriage happens, but most of the time, there's nothing that could have been done to prevent it. So if you've experienced a miscarriage, please don't blame yourself. It's not your fault. It's not anyone's fault. It's a sad and unfortunate event that happens far more often than most of us realize. While the causes are many, it's crucial to remember that a miscarriage is not anyone's fault. Miscarriages can occur at different stages of pregnancy and can be categorized into several types. Let's begin with early miscarriage, which is quite common and typically occurs within the first 12 weeks of pregnancy. Often it happens before a woman even knows she's pregnant. It's usually due to chromosomal abnormalities that prevent the fetus from developing normally. Next, we have late miscarriage, which occurs between 12 and 24 weeks. It's less common than early miscarriage, but it can be devastating as the pregnancy is usually well established by this point. Causes can include health issues in the mother, such as high blood pressure or diabetes or problems with the structure of the womb or cervix. Complete miscarriage is when the body expels all of the pregnancy tissue. It can be a painful and distressing experience, often accompanied by heavy bleeding. But it's important to remember that it's a natural process, and it doesn't mean you can't have a healthy pregnancy in the future. Incomplete miscarriage, on the other hand, is when only some of the pregnancy tissue is expelled. This can lead to complications, so medical or surgical intervention might be necessary to prevent infection or excessive bleeding. Missed miscarriage is a particularly difficult type to grapple with. It's when the fetus has died or hasn't developed, but the body doesn't immediately expel the pregnancy tissue. Often there are no symptoms, and the miscarriage may only be discovered during a routine scan. Finally, we have recurrent miscarriage, which is defined as having 3 or more consecutive miscarriages. It's relatively rare, affecting about 1 in 100 couples trying to conceive. It can be caused by a variety of factors, including chromosomal issues, hormonal imbalances, immune disorders, or structural problems with the womb or cervix. So, as we can see, miscarriages are complex events with many different manifestations. It's important to remember that if you've experienced a miscarriage, it's not your fault. It's a common, albeit painful, part of the reproductive journey for many women. Knowing the different types can help us understand the complexities of miscarriage. Unfortunately, there are many misconceptions about miscarriage that can add to the distress of those experiencing it. Let's spend a moment to debunk some of these myths, offering clarity and hopefully some comfort. One of the most common misconceptions is that stress can cause a miscarriage. While it's true that excessive stress isn't good for any aspect of our health, there's no concrete evidence linking everyday stress to miscarriage. So if you're worried that a tough day at work or a heated argument could lead to a miscarriage, you can breathe a sigh of relief. It's not that simple or direct. Another myth is that heavy lifting can cause a miscarriage. This is also not entirely accurate. While strenuous physical activity and heavy lifting may pose risks during pregnancy, they're not directly linked to causing a miscarriage. Of course, it's always best to listen to your body and your healthcare provider when it comes to what's safe during pregnancy. Then there's the misconception that miscarriage is rare. This couldn't be further from the truth. In reality, about 1 in 4 recognized pregnancies end in miscarriage. It's a heartbreaking reality, but it's important to know that if you've had a miscarriage, you're not alone. Perhaps one of the most damaging misconceptions is the idea that a miscarriage is somehow a person's fault, that they did something wrong, or that they could have done something to prevent it. This is absolutely false. The vast majority of miscarriages happen due to chromosomal abnormalities that are completely out of anyone's control. Lastly, there's the myth that you can't get pregnant after a miscarriage. This is also not true. Many people go on to have healthy pregnancies after experiencing a miscarriage. Dispelling these misconceptions is an important step towards understanding and coping with miscarriage. Remember, knowledge is power, and the more we know, the better we can support each other through these challenging times. While understanding the medical aspects of miscarriage is important, so too is acknowledging the emotional journey. This journey can be a roller coaster of emotions: disbelief, guilt, sadness, anger, and even relief. These feelings are all normal, and it's crucial to give yourself space and time to process them. If you're finding it hard to cope with these emotions, don't hesitate to seek professional help. Therapists and counselors trained in this area can provide invaluable support, helping you navigate this challenging time. Moreover, don't underestimate the power of your support network, family, friends, or a support group. Sharing your experience with others who understand can be healing. Opening up about your feelings can help you feel understood and less isolated. Remember, you are not alone. Reach out, speak up, and take care of yourself. Your feelings are valid, and help is available.